Many of you must have heard that Arman died this afternoon at 1:30 or 1:45 p.m. He had been suffering from some illness, kind of kidney-related disease. He had three times operations, one before Eid and the other one after the Eid. And long before that, he had an operation just to crush the stones. In most cases, when you have your stones crushed, there's a stenting inside. And after operation done, long later, maybe 1 year or so, according to the doctor, you're supposed to go and get it removed. What happened is that he and his son and others did not understand, or the doctor did not tell them. So there was a misunderstanding of what happened. The patient didn't go to the doctor again to follow up so that he could get the stent out of his body. Unfortunately, it got rotten after maybe 1.5 years, and then he got pain before the Eid, and he went to the hospital, got it uh, operated, and a lot of debris was removed, but some debris must have stayed there. So he came back, and after the Eid, his situation once again got painful. So he went to the hospital, got admitted there, and for the third time, the operation was taken. The thing is that the debris was supposed to be removed before the Eid. That was the fault, but it was not easy because it was rotten. What it should have been is that the doctor should have carefully told that as you have something inside, you have to come maybe 1 year later and get it operated. So they didn't say, not so much uh, clear. Probably they were busy, they did not say. And here you see these people did not know. Very rare people know this. So because of this horrible incident, what happened? He had to go three times surgery, and this time he became very, very ill. He couldn't walk. He was lying in the bed, and sometimes just he leaned against something, maybe pillows or like that. Some people helped him, and he stopped uh, movement, you understand. So what happened is that I measured his blood sugar level. It was 25 long back, maybe 3 4 years ago, and I warned his son and he himself that as you have type 1 diabetes, you have to be careful. You don't have to you can't have starchy food, carbohydrate, you can't have sugar. So the thing is that as type 1 is different from type 2 diabetes, in case of type 2, you have insulin resistance, but in case of type 1 diabetes, what happens? You do not have insulin. You have pancreas, and in the pancreas, there are lots of beta cells, and these beta cells are responsible for two main things. One, they produce lipids. It comes to stomach and gets all the food uh, digested, and the other enzyme is insulin. Insulin comes when you have eaten food, when the sugar is in your blood. What happens? With the help of insulin, the sugar can't get inside the cell. A cell is locked, and the key is with insulin. So insulin comes and opens the doors of the cell, and sugar gets inside, and it's burnt, and then mitochondria produces energy. So when you have a lot of food, still you feel hungry because you have a lot of sugar. Sugar can't get inside the cells, and then what happens? The mitochondria is starved to death. The mitochondria can't produce energy. Then you lose your energy, you feel hunger, a lot of problems. But if you have type 2 diabetes, you have insulin, you have to have less and less sugary food, starchy, carbohydrate food, so that the insulin resistance gets lower, right? But we don't follow, we are not concerned. What we understand is that we have to go to the doctor. Doctors got to do anything they want. They will prescribe you medicine, uh, insulin, and that's it. But you have to understand that doctors Their profession is to earn money by helping people. Without helping people, if they can earn money, why should they help others? That's the problem. And when a doctor helps a patient, patient gets recovered, then the doctor loses patient. So in every way, they are not responsible. You have to understand that some basic knowledge you have to acquire. That's why I've been practicing for kind of 8 years, and I've been working, you can see in a sense, Dr. Eric Berg, Dr. Steinberg, Dr. William Lee, Dr. Puza Makhiza, Dr. Jason Jospi. And what is misunderstanding is that Rabindranath did not study literature. I studied literature, I teach literature, but I can't write literature. So you are a medical doctor, you studied medical science, MBBS, but how can you guarantee that you can cure the disease? It doesn't, as I studied literature, can I write literature? Can I write poetry? Can I write drama? It's very difficult, you can't say. So even when I haven't gone to medical school, but still I can be much better doctor because I've been with the best world number 10, top 10 doctors. They have hundreds of videos and I watch them, I comment, I meet a virtual communication. And I know this is the fact. If you do not keep the sugar under control, blood sugar under control, you will have different diseases, retinopathy, kidney damage, liver damage, all the disturbance will come to you and will disturb you, poor cat you. So here what happens, long back he had developed type 1 diabetes, very rare, insulin doesn't get produced. Even nowadays the researchers have found that 20% insulin gets produced by pancreas, but in the past it was thought that no, but now 20%. So 20% is not enough. What you have to do is to cut down the sugar. You don't need to eat rice, bread, this carbohydrate foods, right? So we don't care. We have rice, bread as our staple food, the main food. This is what we really eat. 2,500 years ago, Hippocrates told that you are what you eat. He also told that food is thy medicine. So if you have a disease, you have to eat accordingly. That's the medicine. But what you do is you go to pharmacy, you go to a doctor, the doctor does nothing, he just prescribes medicines and you take medicine and initially you're fine. You have diabetes high, but when you measure it is 10. Why? It's because you have medicine. It will never cure. It will keep your insulin resistance even stronger, worse for you. So Arman is very unfortunate. He was one of the rarest patients. That is, he had type 1 diabetes. When I measured it was 25. It was horrible. I measured him in 2 times, and every time I talked to his son, I talked to him. And as I go there for collecting milk and sometimes eggs, I even talk to his wife. I keep on talking, but nobody cares. What they think is that I'm not a MBBS doctor. MBBS doctors got nothing to do with solve the problem. The thing is that I am a student, I am a teacher of literature. What can I write? So Rabindranath was not a literary student. He did not study honors in masters in literature, but he wrote. So that is production. So to cure a disease, it's a production. Even when you haven't gone through medical books, even when you studied medical sciences, you may not be able to do it. So it is different, it's philosophical. If you have sleeping problem, how can your doctor solve the problem? Can a philosopher can do it? So I keep saying this, that these foods will kill him. Some days ago I went there for collecting milk, and then I also told that under wrong treatment, only medicine and medicine, a lot of rice, bread, and all these things, and these are really horrible of effect. And that's how he died at 1:30 or 1:30, 45 p.m. this afternoon. And after Isha prayers at our mosque now is at 8 o'clock. So after 8:30, at 8:30 at Idgah is Namaz-e Janaza will take place.